Okay, welcome back everyone for our panel discussion. Over the past few weeks, we've all heard the very promising news of two COVID-19 vaccines about to be approved and available. In fact, we may hear today the first one from Pfizer. Um, so they've already started shipping and pre-positioning. Just waiting for the final word. It's today or tomorrow, we're hoping. And then probably a week away after that is the Moderna vaccination. And then on top of that, there's three others that are in the stage 3 trials. So really exciting. And we wanted to pivot and get this panel discussion going since it's such a timely thing. So with us today, we have three pharmacies that are approved to provide vaccinations, along with an industry compliance expert. So without further ado, I'd like to introduce our panelists today. To my left, or on the screen, is Charlie Hardig, the CEO of Hardig Drug, the Hardig Drug chain that's located in 3 states and headquartered in Dubuque, Iowa. And then to my right is Jeff Hedges, our industry expert, compliance expert from RJ Hedges and Associates. And then below me on the left is Caitlin Yalto, who was a panelist last time as well. Once again, thank you for joining us, Caitlin, from White's and Harry Race Pharmacies in Sitka, Alaska. And then last but definitely not least, Sam Silamani from Westmont Pharmacy in Westmont, Illinois. Welcome, panelists, and thanks for joining me today.
Hello, thank you for inviting.
Okay, let's get right to some questions. Let's begin by discussing the process to be a provider. I know there's people that are watching us today that are thinking about doing this, that haven't done it yet, or maybe in the process. So let's talk a little bit about the process. And Sam, let's start with you. You applied through your wholesalers. So tell us a little bit about that process.
Sure. Yeah. So I applied through my wholesaler, which is McKesson. They had an initial application that just required collecting the license information, pictures, and even model numbers of my fridge and freezer, proof that I completed my 2020 CE for my vaccine update, registration with like a vaccinefinder.org, make sure I was part of the state immunization registry. Once I provided these pieces of information, that's when they actually sent me the agreement to get into the actual administration of the vaccine. So that required the pharmacy network administrator agreement with the CDC with my wholesaler, and as well as the program provider agreement form from the CDC. Then my wholesaler on top of that did request 2 more documents. That was the COVID-19 vaccine agreement with them, and then also a business association associate agreement. And the timeline on this was pretty quick. The initial application from when I applied with licensing and showing that we can take the vaccine to getting the legal agreement from the wholesaler was, I think, about 48-hour turnaround time. So it was really quick.
Wow. So you find the process was relatively easy then?
As long as you have an organized Google file drive somewhere with all your license pictures and everything, yeah, it wasn't too bad to upload everything.
Okay. Well, so Caitlin, you chose to apply through the state's health department and the CDC and not through the wholesaler. So tell us why, and then how that process went.
Yeah, Alaska is a little unique, and we were actually approached by the state's immunization program through the state of Alaska. And that was just our first inkling of COVID vaccine through the state of Alaska. So they enrolled us as a provider, very similar to if you do a vaccine for children or any kind of state vaccine program for kids. So we basically did exactly what Sam said, but instead of doing it through their wholesaler, we went through the state of Alaska.
Okay. And Charlie, you have 3, as I mentioned before, you have stores in 3 states. You also apply through the health departments of those states and the CDC. So for those listening, I mean, how did you find the process? And do you have anything to add to what Sam and Karen
said? The states obviously varied some. Hardig Drug took a 2-prong approach, actually a 3-prong approach. We have a long-term care pharmacy group, which is an MHA member. So MHA was one of the network administrators. So we applied through there. Similar to Sam's process, we had a direct contract with the CDC, and then you have a contract with MHA, and you have a BAA, Business Associate Agreement, for privacy purposes. That was access for phase 1A product and 1B product. Then we also had an agreement directly with CDC, HHS for phase 2 product and phase 3 product. Those will come directly to, we have a wholesale warehouse. Those will come to our warehouse and get dispersed by to our pharmacies, our 23 retail locations. And then we also, basically, our local pharmacists were very much encouraged, and our directors of pharmacy were encouraged to talk with each local healthcare agency or local public health agency. In Iowa, there's 99 counties. In Illinois and Wisconsin, there's less. But we essentially did outreach to each local public health agency in each county. And there was no actual, and we did what each state had a separate provider agreement. And those provider agreements weren't with CDC directly. They were with the state. And actually that, we picked all 3 methods on purpose because we wanted to be a front runner, and we want to make an impact right away in this process. This was the way we could do it. And actually, as it pans out, we just got off calls yesterday. It sounds like our local healthcare, public health agencies are going to be the ones providing vaccine first to Hardig Drug. And we're slated to get that 2 or 3 days before Christmas. So around December 22nd, we have about half of our stores who public health agency, the local public health has asked us to take on anywhere from 100 to 1,000 doses. And they're actually going to send healthcare providers to us, like local independent physicians and PT, OT, those kinds of folks to come get shots. So,
okay, great.
You gotta go where anyone can get you the allocation of vaccine, because it's going to be very tight, I think, in the first phase.
Yeah, that's what it sounds like. So, well, Jeff, as the compliance expert on our panel, do you have any advice or concerns or things that you'd like, for those that are considering applying and going through this process?
Well, this is a good example with the other panelists on how diverse and different the process is of getting enrolled to get the vaccine. The biggest thing, you should be listening to your wholesaler and your state Department of Health. They are the people who are going to be providing everything to you. And wherever you may be in any one of the 50 states or the 5 possessions, follow what the guidance you're getting locally at the state level, because they're the ones who are going to get everything to you and make sure you comply with the storage requirements and everything.
Okay. Well, let's move. So we know there's 2 vaccines right around the corner, and then I mentioned already there's 3 more that are in phase 3 testing, and we don't know what those requirements are going to be, but we know that Pfizer's vaccine requires individuals to receive 2 doses of the vaccine, and so does Moderna's, and but Pfizer has a unique. It has to be stored at 70 degrees or minus 70 degrees Celsius. So that brings some really interesting logistics, I guess. With that in mind, will you be able to provide? How is this part working? Are you going to be able to provide both vaccines, and in the future the other vaccines? Is there some protocol in determining which vaccines you're going to be able to provide? Let's start with Charlie.
So most of the vaccine we seem to be getting, from what we've been told, but there's nothing concrete yet, is Moderna. But we have a plan, and we've created a process and a rough sketch of a policy and procedure in place to take ultra cold. I did note that there's 2 kind of things I would note there. The CDC put out packaging instructions and essentially what you're going to get when the vaccine hits your door. Pfizer actually it says in the notes, I don't know if this is true, it says in the notes that they're going to actually send you dry ice pellets to recharge the ultra cold storage container that you're going to receive on day 1. So essentially you're going to receive an 80 pound cardboard briefcase with 975 doses of Pfizer vaccine. And then the next day you're going to receive a shipment of dry ice pellets to recharge that. So you've essentially given yourself a window of at least 5 days to dilute and inject those shots. That's per the written materials by CDC. But we're right now we're focusing on having the Moderna vaccine coming in from the local public health. And we're also likely going to receive mostly Moderna vaccine in phase 2. I think from what we can tell from our state, the 3 states we're in, the public health and state health departments are focusing on the ultra cold in the academic medical center settings or hospital settings that have ultra cold storage, and they're going to focus locally with Moderna, but that's really state by state, I think.
Okay. And so, Caitlin, you have a unique challenge up in Sitka with this, and I understand that you will be getting the Pfizer vaccine. Is that accurate, or?
That is what we're thinking. Yes, we do have some unique challenges. We're located on an island in Alaska, and the only way in is to boat or fly. So all of our vaccine would be delivered via plane. We do have a regional hospital that services some of our local community and villages in Southeast Alaska that does have or will have ultra cold storage. We are also partnered with a community partner. So with our EMS and fire halls in Sitka, they are slated to be our backup depot location. We were able to get our hands on a ultra cold freezer, and they have some generators so they can meet the CDC requirements for power capacity and backup, which we couldn't meet at our pharmacy location at this time. So we expect that hopefully in the next week or so, we would be getting some Pfizer doses, ultra cold, shipped direct to our hospital, which either would then be redistributed from the hospital, or depending on how our state decides to do it, distributed from the state. But I think they backpedaled a little bit and have told us that the Pfizer containers that are coming with those large amounts of vaccine, they won't be breaking them down. So they're just trying to anticipate areas in our state that can accommodate all 975 doses in that basically 5-day window. But in the future, we hope to be able to store some at our EMS depot, and then Moderna will be easier for us to store either frozen or in the fridge.
Yeah. Okay. Well, so that brings us to, there's both of these, the first 2 vaccines are 2-part. So how is that process working? How do you go through and ensure that the person gets the second dose? Do you get all the doses at once and then have to store it, or will that be another shipment? And is there a guarantee that you'll get enough to be able to do the second dose? That seems very difficult situation. So Sam, let's start with you. How are you planning to handle that?
Yeah, so I mean, we're going to try to do the best of our ability. I would hope that and think that this will be a team effort, like pharmacy wide, right? So, and if let's say I can get the first dose done for a patient, they can't come see me for the second dose, or we don't have it. I know with Illinois using the iCare platform, they're gonna. I'm thinking when the patient looks to sign up to get the vaccine, they'll have access to all of the sites that are available to get this vaccine. I know there's a lot of reporting being done with it of how many vaccines we have in stock. So I'm hoping that they'll be able to leverage that platform saying, hey, Sam doesn't have it, but I can go to X pharmacy and get it for the second dose. So at this point, I think just doing really good reporting and making sure we're keeping our numbers up to date so people have the most information as possible.
Okay. Yeah, I mean, this seems like a challenge for sure. So Charlie, what are your plans with this in your stores?
Phase 1 and phase 2, I think we're going to be pretty tight. Our 2 of our states, we haven't heard from Illinois yet, quite frankly. 2 of our states, which isn't surprising. Sorry, if it was from Illinois, but Wisconsin and Iowa are telling us to if you shoot the first one, you shoot the second. So we're getting allocation, and all of those shots are first dose allocation, and then we're going to get another allocation in 21 to 28 days for the second dose. And we are not supposed to take a person who was at a different location and give them their second dose. So I think that's definitely going to be a state by state determination, or maybe even county by county. So that's where we're going on that. And then I think Sam's right. As phase 3 opens up, which is when the general public can get it, I have a feeling it's going to be a lot more loose in terms of who's going where to get what shot. And I'm sure the public health will kind of change their guidance as they go. It is very important just to remember that if you receive Pfizer your first dose, you must receive Pfizer your second dose. You cannot interchange products. So that's one thing. The other thing is early in phase 1, if you are going to be doing injections, please bear in mind that on dose 2, they're finding that there are some side effects, which is like kind of a hangover effect, fatigue, tiredness, headache. And if you're going to do phase 1 and you're going to do your local fire department, do not shoot all of your local fire department on the same day. Otherwise, if you have a fire the next day, you might not have a building after that day. But just remember to start staggering doses, especially for critical infrastructure.
That's a really good point. Well, and we've taught you mentioned phases, so let's kind of pivot a little to phases. The first phase is going to healthcare providers, first responders, and such. How are you preparing for this? How are you getting the word out? And thinking about phase 3 when it goes to the general public, what are your plans there to get the word out? Are you doing requiring appointments? Are you marketing? What are you doing? So let's just start. Go ahead and start with Sam on this one. What are you doing to get the word out?
Sure. So I'm on a senior resource committee group with the village. We have our monthly call. I just updated everyone this past call that I am an approved, conditionally approved vaccine provider. In that group, there's a lot of retirement home, like directors, if you will. A lot of other people that service seniors. So that was, I think, a really strong medium for us to start getting the word out. I already saw on Facebook someone else started putting us out there saying Westmont has the vaccine. I think it's just important for us to be able to focus on the phase 1 individuals. And then as the phases move on, I think definitely Facebook will be a big portion for us. We have a lot of followers on Facebook. And then just kind of word of mouth. We're a smaller town, so a lot of people kind of start knowing us. We've already become the resource for COVID items, PPE items, and supplies. So I think this kind of brings it to a full circle, and they'll know that we'll have the vaccine as well.
Okay. And Charlie, how about you guys?
Yeah, we're really going to focus. We're not really going to move on any communications except for education pieces over the next probably 3 to 4 months. I think it'd be premature, and I think if you start trying to encourage people to come to your store for vaccine, they'll be disappointed because you probably aren't going to have it. Even large chains, I don't think, are going to have a lot of vaccine in that phase 1-2 area. We are gearing up. We have a clinical pharmacist who is putting together some pieces. She's doing some talking. She's doing some like webinars and things with local groups and senior centers. But and also a lot of Facebook, social media, just like Sam had mentioned. But that's kind of planned for us. It's probably gonna be released in March, April, May. Not right now. I don't think it's the time yet.
Okay. So once the vaccine becomes more widely available and we move into, say, phase 3 and 4, how do you plan on providing the vaccines? Are you going to be, because we're talking then mass scale, so you're going to do things. I read one suggestion of Driveup vaccinations. Are you looking at things like that? And let's start with you, Caitlin.
Again, I feel like Alaska is a little unique. We're looking at the middle of our winter and trying to do a Driveup clinic, and it's awfully cold up here. So we have partnered with our local EMS and fire hall. And like I said, they're kind of like a combined unit here in Sitka. And they have a great space where we can do like a unidirectional patient flow. So people will be coming in one way and out the other. So we're going to do probably pods of people or, points of care where it's strictly an appointment-based model. You know exactly who's coming and when, and we can allocate the appropriate amount of staff and supplies and equipment. And so instead of doing it outside, we'll probably be doing it inside. That said, though, we have had in our city the Driveup clinics, and they have been very successful. People do enjoy that a lot. I think, though, with the documentation perspective from this type of vaccine and the data collection, it's a little bit more than a traditional like flu, which is pretty easy in terms of vaccine and drive-throughs. So this is a little bit more like a hands-on internal kind of clinic idea for us.
Okay. Sam, and we're going over because we had a technical glitch for starters that cost us about 5 minutes, but I do have a number of questions. So Sam or Charlie, do either one of you have anything to add to what Caitlin said there on what your plans are once you get to the phase 3?
Not at this time. It makes sense. She kind of covered what I was going to say.
We anticipate
Okay.
it's going to be like heavy. We anticipate it's going to be like the heaviest couple weeks in flu, kind of for those first couple months. It's going to look like your busiest flu shot week for probably a month, which is going to be, it is what it is.
Okay. Well, Jeff, let's talk some paperwork. Get you back into the mix here for a second. Let's talk paperwork. Any special forms pharmacy needs to consider, such as patient consent forms and other types of forms?
The biggest thing is that it's all about the process. You're still going to need your screening questionnaire to be completed by the patient prior to the vaccination. You're going to need to have your staff trained. You have to have a good policy procedure. Now, one nice thing is that as a process, you already have that established with your flu vaccines. So working through that, that's going to following those processes is going to help you a lot. And one of the other items is making sure you have your billing capability prepared now and as everything comes through. And the better your process is defined at your wherever you're giving the vaccines or within the pharmacy, that's going to make or break you as far as the success or whether you have any hair left when after a couple months, because you don't want to be tied down with paperwork and processes that don't work. So use your flu clinics right now to really tighten up those processes.
Okay. Sam, do you have anything special in your state that Jeff didn't cover?
Not that I know this time. If there's,
Okay.
I know my wholesaler might require some extra stuff on their end for admin, but
Caitlin or Charlie, either one of you, anything to add from what Jeff had to say?
Your processes and policies should probably also be really closely aligned with your immunization registry. So in Iowa, everything's run. You're going to get all of your drugs, all your shots, and it's going to get loaded into what we call IRIS. But everyone has an IISID. It's called WERS in Wisconsin and iCare in Illinois. But they're all essentially just that immunization registry. And you better have somebody on your team be very familiar, because you may be transferring doses, correcting quantities, adding, one of the big burdens on labor is going to be adding those shots and the records either manually or somehow through a feed, like Tabula Rasa has a feed, or there's other organizations that have pharmacy management feeds into IRIS. That's an area where I think a lot of folks need to bump up their attention, because some states have like a 7 or 30-day window in entering those doses, and the CDC wants them within 24 hours. So that's going to be a new burden for a lot of people. It is for us.
Yeah, absolutely. So that's a great point, and it took me right into that next question about the reporting side of things. So, Kaylin, let's start with you, Kaylin. Anything to add to what Charlie said as far as the reporting goes in Alaska?
Yeah, we've gotten guidance that says within 24 hours for sure for your reporting into your electronic vaccine record. In the state of Alaska, it's called Backtrack. And it is going to be intense. It's a lot more data than we were adding prior to now. Before, we were just using it as a collective concept, like, did a patient receive a vaccine in the past, and are they eligible for something now, today, or in the future, as opposed to making sure this record is accurate and complete, down to the patient's name, birthday, sex, mother's maiden name, occupation. There's a whole slew of things that have to be recorded now that we didn't necessarily focus on before today. So our online booking software and survey questionnaire is now having to include all of this new information so that we have it all to be able to go back and add it in to our vaccine system within 24 hours.
A lot of work. And Jeff, I understand. I mean, there are states that don't have these reporting programs. So can you give us any guidance on what that looks like in those states?
Yeah, there's a number of states that either have nothing for you to report at the state level, or they have a voluntary system. The voluntary systems in a lot of these states have not been funded well, so data entry is optional, and if it works at all. Again, your state or local health department is going to provide that reporting guidance to you, and then you're just going to have to be flexible and very adaptable. Fortunate thing is, independent pharmacy lives on adaptability and flexibility. So the chains are going to struggle more on this than what the independents will, because you can adapt quickly.
Yeah, that's a good point. Okay. So just two more questions. Vaccinations are going to be free to the public. And you're obviously going to be spending staff time, and we heard if not only to provide them, but then just to do the reporting. So first question is, how much time are you spending now? How much time do you expect to spend? Let's start with Caitlin.
I can't tell you how many webinars I've listened to just for COVID. I participate in CPESN as a network. I'm trying to be a fellow there too. I participate with our state registry. I listen to, they're called echoes. We have blasts for the state with EMS and myself. I've gone to emergency planning meetings here in the state of Alaska. It has been intense, a lot of data and information, and a lot of pre-planning, not gonna lie. But hopefully now, with all that said, we can operate, like everyone else has been saying, with a very intense and robust kind of flu-style clinic. So now that we have most of our flu behind us, at least up here, it's still trickling in, but most of that's behind us now, thankful. We can just use that model and create a very robust style clinic. And we're considering teams of people. So a vaccinator with like maybe 2 staff members and some community volunteers to kind of help roll out what a single line of vaccinating would look like.
Okay. Well, Sam, do you have anything to add there?
My biggest thing, kind of like adding on to that, is just worrying about kind of having a pharmacist run the operations, because being a pharmacist and the owner, it's like when we were saying with a heavy flu day week, it's hard to keep operations running while you're still doing the vaccine. So my biggest, I think one thing that I'll do is have a pharmacist help with running the operations with all the applying. I put myself as the only vaccinator, so that'll be one challenge. I'll have to kind of keep the machine working while we do this on the side.
Okay, I mean, this is sounding complicated, and it's sounding like a lot of work.
It's
which
so
then
exciting,
begs the
Brad.
question, what's that?
It's so exciting because there's light at the end of this tunnel. I'm telling you, we're just really jazzed about being able to help.
Exactly.
Yeah.
I am. I'm just excited to be able to do something.
No, I think, and that that really kind of gets me to the final question. But I guess it also begs the question of how are you going to get reimbursed, and how much is that a known entity at this point in time, and how does it work? So Charlie, let's start with you on that.
Yeah, it's known for the most part. CMS has come out with their Medicare Medicaid schedule. It's $16 and change on first shot, $28 and change on second shot, for a total of $45.33 for the full dose, which is fairly good. It's in line with most admin fees at a commercial or Medicare rate. I think it's fair. And the challenge is going to be on before Christmas. Heart Drug anticipates giving some injections. Question is, are all of our other payer networks going to be in line? Because the CARES Act requires that commercial plans and all other plans pay for the vaccine, and that there's no copay associated. I recently just executed our amendment with Caremark, for example. I can't share the rates given the antitrust issues, but I think if you have any direct contracts, I would recommend anyone on the call start reaching out to your payers or reaching out to your PSAOs to make sure you have those prices in place, or you're starting to at least work through that, because you probably have about 20 to 30 days before the vaccine is going to hit your door, and you want to make sure you can bill it. We are anticipating we're going to have some rejections where we're not going to get paid. What we plan on doing is just, administering the injection, $0 copay, and we'll chase it down the back end. I hope it's not that many, but it very well could be. Sure. There's also, sorry, one other quick to add. HRSA is also doing a no insurance or under insurance provider fund. So if someone comes in and they're homeless and they have no insurance, you still give it to them for $0. You can submit to the government and they will actually reimburse you. So there's definitely going to be safety net programs too.
That's great. So then, final question for all of you. There's going to be people that are listening to you today that are on the fence as to whether they should go through and do this. What would you tell them to convince them to do so? Let's start with Sam.
Sure. Kind of going off of what Charlie was saying, being able to be part of the process, part of the solution. I just think this is a huge opportunity for pharmacists. We've been fighting for this opportunity to be part of the healthcare team. This is our chance to show that we can help and we will help and help solving this pandemic. For us, our store has been a resource, kind of like I mentioned, for COVID supplies and PPE. I think this is just kind of puts it into a full circle for us to provide the vaccine. Reimbursement rates are there. Anything helps the bottom line at this point. And I think if you can set the processes up, kind of like what Jeff was mentioning, to continue it, I think it's a great add and a great opportunity for us as pharmacists.
Okay, yeah. Caitlin, do you have anything to add there?
I think for independent pharmacy in particular, and I imagine that's most of our viewers today, is getting another pharmacy partner, like someone in your area that's done it and can tell you and help you complete the process. It's one step at a time and it's a lot of little hurdles, and anyone who's done it can help you get past them one at a time.
Yeah, I think as Giovanni said in his session, pharmacies, you're passionate about what you do and passionate about helping your communities. And Charlie, that you mentioned that kind of got this question started. So do you have anything else that you would say to those that are on the fence?
I think we're aligned. We're going to help people. We're going to make, I think, pretty fair reimbursement and are fair enough. From our projections, and we got to let's get past this thing. It's so disruptive. This is one thing we can actually do. I feel pretty helpless the last year and a half or 10 months. Excuse me.
Okay. Well, listen, I really, really appreciate you all staying longer than we had originally asked you on this panel. I think it was a lot of great information. Thanks again for your time. Thank you to the viewers for listening in. We don't have time to take questions right now. If you've put questions into the question and answer, we will get back to you with the answers to those questions. So once again, panelists, thank you very, very much. Appreciate it. And I'll be back in just a few minutes with Brian Hillman to do a quick wrap up and then my demo. Thanks again.
Thanks, Brad.
See you all later.
Thank you all.
Bye, everybody.